Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel. And today I'm just going to talk a little bit about two new patients that I'm working with that I just started seeing this week. One of them is a 70-year-old man with low back pain, and the other is an 82-year-old man with low back pain. So let's start with the 82-year-old because I saw him first. He has low back pain that's better when he sits. It's worse when he walks. He said he can't really walk more than 50 feet before he feels like he has a metal belt around his low back, and he gets pain into the low back area, which is concerning for him because he knows he has stenosis. He brought his MRI so I could see the report, and he pretty much has he has mild stenosis at every level from L2 down, but it had not been a problem as far as chronic low back pain for quite a while. He said they did another MRI just recently because they wanted to offer him epidurals, and they wanted to see how much his stenosis had progressed. And they said, in fact, it had barely progressed at all. It really had not gotten worse in the past 7 or 8 years since his last MRI. So, kind of interesting because he said, well, my pain has progressively gotten so much worse in the past 7 or 8 years. And, he has a group of friends that he grew up with, and, they're all around the same age. And one of them has a house in Florida, and they love to go down there in the winter, and spend, several weeks together. And he was very concerned because he really can't walk very far, and he didn't want to be the wet blanket, not able to do anything that everybody wanted to do. So he wanted to get this epidural so that would get him through his vacation in Florida. So he got the second MRI, and like I said, the stenosis had not really progressed. But nevertheless, he still had a lot of low back pain. And he really didn't know what to do. Well, fortunately, some of his friends have come and been patients of mine for similar issues like back pain and shoulder pain, neck pain. And he decided, yeah, I'll give it a try. Let's see what happens. So on exam, I always want people to point where they feel the pain. It tells me a whole lot. More than muscle testing, in fact. If you know your pain referral patterns, for back pain referral patterns are often the best clues for where you need to start looking. So he pointed to where his pain was, and it was all around the iliac crest on both sides, below the iliac crest. So not a back muscle at all, hip muscles, in fact. Causing low back pain. And when I, with his permission, was palpating and pushing on the gluteus medius area to see if there were trigger points, it was very uncomfortable for him. And he knew that this was part of the problem, if not exclusively the problem. His QL was tight. His spinal erectors were tight as expected. So what I decided to do was to treat segmentally with electric stim for the stenosis, and I also treated motor points in the gluteus medius maximus. And then I did some trigger point release on those gluteus medius muscles. And he tolerated it very well. I'm always a little more worried with someone who's 82 about how much inflammation I'm going to create and how much discomfort I'm going to put them through. But in reality, if the man wants to get better, we have to address the trigger points. So it's now or never. We really should just get on with it and get started with it. And I explained to him what was going on. He said it's nothing you can do is as bad as those epidurals. So, which didn't work, by the way. They didn't give him a bit of relief. He had 2 epidurals on the same day, not a bit of pain relief. After treatment, he got up and he said he really could feel the difference. And after sitting to put his shoes on and then getting up, he said, "Oh, that was so much better. That was so much easier." He could definitely feel the difference. So I told him, you're probably not going to feel a lot of benefit for the next couple of days. You're going to be pretty sore. I want you to do some heat, sauna, hot tub, whatever you can do, to keep the inflammation down and keep things moving. But he could tell that he felt better. I know we'll get more done the next time I see him. But I thought it was interesting because if I just basically took his medical diagnosis and just treated him according to the medical diagnosis, I would not have probably relieved his pain either, because I would have missed the glute medius trigger points. The other patient is 70 years old. He has pain when standing, low back pain, right at the base of the spine, right where it meets the sacrum. And he feels better when he sits, just like the other guy. And he gets pain down the front of his legs. And we talked about that. I was thinking, okay, could it possibly be he has? Oh yeah, by the way, he gets a lot of glute pain too. Okay, so glute pain that seems sort of sciatic, but it really doesn't go all the way down the legs. It's really just the glutes, and then the front of the thighs. I was thinking, okay, maybe this is like some femoral nerve entrapment or something, but in fact, it was more muscular than nerve pain. We talked about it. I really wanted to clarify if it felt like nerve pain or if it was just achy, sore, and he felt it was muscular. So I really was thinking about external rotators, the piriformis, gemelli, obturator internus, possibly causing a bit of sciatic pain. Oh, and the reason I was really thinking about sciatica is because he complains of numbness on the bottom of his feet, which I'm going to be addressing more the next time I see him. I didn't get a lot done for that, but I got to tell you, it seems a little bit more like a plantar fasciitis type thing, as far as where the pain and numbness is. So we'll be working with that, maybe looking for like a plantar nerve entrapment. But anyway, so the low back issue, I really think, based on some other discussions with him, like, do you get sharp low back pain when you try to put your pants on? You lift your knee to put your pants on. He says, "Oh, I can't even dress myself like that. I have to actually sit down to put my pants on." So I knew that's a psoas issue. That's definitely a psoas issue. And based on where his pain is, right there at the like L5S1 area, that really usually the psoas is like L4, L5, L5S1 type pain at the spine, especially when you stand or walk. I said, if your psoas is as tight as I think it is, it must inhibit your ability to walk. You probably can't take a very big stride because your leg can't go back. He says, "Oh yeah, I walk like a 70-year-old man." And I mean, he was laughing because he knew he was being ironic. He is a 70-year-old man, but he has to take tiny steps. and he can't really extend back at the hip when he wants to walk. Um, so I started out, and he also has spinal stenosis. It's mild stenosis, but he does have spinal stenosis, and he's 70, so this is sort of part of the territory. I treated segmentally. I treated glute medius, piriformis, the rotators, glute max, stim, about 10 minutes for him. I did treat his biceps femoris and his peroneus longus as well, in case there is a bit of sciatic nerve involvement. I did that bilaterally, and then when I could put him on his back, I treated his psoas and his rectus femoris, and he felt a huge relief when he stood up. He smiled. He said, this is different." And he could feel that release. So I walked him through a psoas stretch where you're standing with your hands on your hips and you look up to the ceiling. And I said, I really try to do this every 2 hours so that if you only get, so that you'll probably at least do it twice a day, but have the intention of doing this every couple hours, just for a couple minutes of just deep breathing and looking up at the ceiling. I need to start getting your psoas back to a better length. I'm releasing it, but we need to stretch it to get it back to a better length. So really, if you try every 2 hours, you'll probably do it twice a day, and that will be a big help between now and the next time I see you next week. And then, of course, we're going to do more work on the psoas, and we're going to keep working on it until you don't have it pulling on your low back, and then you're going to walk better. And he really did feel a big improvement. He's still walking kind of stiff. I know there's more work to do. You can't do miraculous work in one session, especially with somebody who's 70 or 80, but you can shift their pain. And I said, do you feel like your pain is lowered at least 50%? Because that's in my mind where I need to get somebody who's in chronic pain. I need to get them to 50% pain reduction in the treatment room. And then generally what you'll find is after a few days of soreness, if they're over 60, 70 years old, after a couple days, 3 days of soreness, they start to feel much, much better. But I want to aim for like 50% pain reduction. For younger people, I hope for more than 50% pain reduction. But we're talking about people who have decades of muscle tension that we're dealing with, not 2 decades, like 4 or 5 decades of muscle tension. So 50% pain reduction is not nothing. And people are very grateful when everything else has failed, including epidurals, to get 50% pain reduction. So I'm seeing them both next week. I'm looking forward to seeing what they said. I do know that one of them left me 5 stars on our scheduling app that reaches out for feedback. So I'm hopeful that means he's feeling a whole lot better. I suspect both of them are going to be feeling a whole lot better. And I think it's just interesting because the doctors who focus entirely on their spine are really missing 2 major causes of low back pain: glute medius trigger points and a tight psoas. An epidural is likely not going to help a short psoas, is it? If your psoas is short, it doesn't just suddenly release when they give you an epidural. And I don't think any amount of anti-inflammatory is going to make a tight psoas stop pulling on your lumbar spine and compressing the discs and causing a lot of low back pain. So I guess the whole point of what I'm saying is I always want to know what the medical diagnosis is. I want to know what testing has been done. That really helps. You can rule things out so you're not worried that you're missing cancer or some kidney stones or something. It's great to have somebody who's already had a lot of testing. and then you don't have to worry that you're missing something like that. You can really focus on the musculoskeletal issues. But it's just if we just took the diagnosis and created a treatment based on the diagnosis, you know, those two would not be doing very well, in my opinion. I would have treated segmentally and hope for the best. And I don't think a psoas is going to release just because you treated segmentally for their stenosis. So that's the episode for this week. I hope it was of some interest, and I appreciate you guys sending me positive feedback. And if you want to reach out on Instagram, it's Rich Hazel. My website is richhazel.com, and the Podia online courses are richardhazel.podia.com. Okay, have a great week.